From the Pep Radio Newsroom, these are the stories we are covering at this hour. We start with this tragic news from Louisiana. No, not what happened on Bourbon Street. This is the story of the death of what will likely be thousands of people from preventable diseases. Officials in Louisiana held a series of meetings in October November 2024, telling Department of Health staff that the state would no longer allow them to promote COVID, flu, and mpox vaccinations. The new policy would be implemented quietly and would not be put in writing, four health department employees told NPR News. They asked to remain anonymous. The directive was shared by two lower level officials in the department after the state's Surgeon General was unable to attend, the staff member said. Employees were told they could not send out press releases, give interviews, hold vaccination events, give presentations, or create social media posts encouraging the public to get vaccines. They were also barred from putting up signs at the department's clinics announcing COVID, flu, or mpox vaccines were available on site. I mean, do they want to dismantle public health? One Department of Health official staffer said. In 2023, 652 people in Louisiana died of COVID, including 5 children, and the state is tied with Washington, D.C. for the highest rate of influenza in the U.S. Flu killed 586 people in Louisiana in 2022, according to data from the state's health department. As of August 6, 2024, the U.S. reported 60 deaths and 33,435 cases of mpox. 309 cases were reported in Louisiana through February 2023, the last data available before the state stopped reporting cases. The policy change can be traced back to Governor Jeff Landry, a Republican, an anti-vaxxer who served as the state's attorney general during the COVID pandemic, as well as Robert F. Kennedy Jr., a Landry ally and Donald Trump's pick to head up the U.S. Department of Health and Human Services. In his role as attorney general, Landry spoke at a state committee hearing in 2021 about his opposition to adding the COVID vaccines to the childhood immunization schedule. Kennedy testified alongside him, presenting false claims about COVID vaccines. As governor, Landry has signed 5 bills and 2 resolutions this year rolling back vaccine requirements, limiting the power of public health authorities, and questioning vaccine safety. Landry appointed Dr. Ralph Abraham, a family medicine doctor and another vaccine skeptic, to be the state's Surgeon General. In a statement, the Louisiana Department of Health told NPR it has been reevaluating both the state's public health priorities as well as our messaging around vaccine promotion, especially for COVID-19 and influenza. The department described the move as a shift away from its one-size-fits-all paternalistic guidance to one in which immunization for any vaccine, along with practices like mask wearing and social distancing, are an individual personal choice. The statement did not address mpox vaccinations. It is at this point that we must all hope that most of the United States isn't dead in the next 10 years at the hands of some very stupid politicians pretending to have medical licenses. And now this news from Pennsylvania. 3 Democratic state lawmakers gathered in Lancaster on Tuesday to renew their call for a higher statewide minimum wage, which has remained at $7.25 per hour since 2009. Lancaster State Representative Izzy Smith Wade-L, along with Senator-elect Patty Kim of Harrisburg and Senator Art Haywood of Montgomery County, said at a press conference that they plan to introduce legislation to more than double the current rate to $15 an hour and include an annual cost of living adjustment tied to the rate of inflation. If you want the labor of Pennsylvanians, you should, their labor is worth at least $15 an hour, Smith Wade-L said outside Two Dudes Painting Company on Poplar Street. I cannot imagine any of my colleagues in either the House or the Senate having the courage to go back to their districts and tell their constituents that they're not worth $15 an hour. Heck, they're barely worth $7.25 an hour, according to those on the right of this argument. In front of the lawmakers stood a poster board depicting a map of surrounding states and their minimum wages. And would you believe every single state, including Delaware, Ohio, and West Virginia, has a rate higher than Pennsylvania's? Who would have thunk it? Which matches the federal minimum wage. Nationally, 30 states have a minimum wage set at higher than the federal minimum wage, according to the National Conference of State Legislatures. Only 13 states set theirs at the federal $7.25 per hour rate, with 7 states having no official minimum wage, thus their wages defaulting to the federal minimum. Two Dudes chief executive Pete Barber said it just makes good business sense to pay workers fairly and equitably. His company is chartered as a B corporation according to its website, meaning it voluntarily commits to providing fair wages and a variety of social and environmental practices. For more information about these or any of the other stories we cover, please visit paequality.com and click on the PEP Radio page. Be sure to download the Live 365 app to take PEP Radio with you wherever you go. That's the news at this hour, and now back to more music on PEP Radio.